Hello, welcome. Hopefully everyone can hear me and see me. And I'm here to moderate and present the third Venture Cafe, the Life Science and Health Venture Cafe that we're holding now on a monthly basis at the beginning of every month in Venture Cafe. And I'm representing our partners, which also include the municipality, Gemeente Rotterdam, and the Erasmus MC. And I think some of my colleagues from those organizations are there in the audience. And this month, we're looking at health data. And we're really excited. We have two great presentations for you this afternoon. The first one is from Landscape. And the second one is from a data scientist, a specialist from IBM. I'm going to talk a little bit more about them when I introduce them. But I think for everyone, hopefully you've joined because you're wanting to know more about how we can use intelligence and AI with the data. I think the world we live in today and what we've seen last year as well is data is so crucial, so we know how to find good solutions within healthcare. And we definitely need experts who have experience in this field to point us in the right direction. So I'm from Rotterdam Partners. I'm joined together with my colleague Sasha Hyman from Innovation Quarter, and we are both working together for the region to help collaboration for international companies in the life sciences and health field. So we will be hosting these cafes with the partners over the next few months, and if you have any questions after the sessions, please check in with me or Sasha, and we can give you more information how we can help support connecting you within the life sciences and health networks. And I would say let's enjoy the presenters for today, who are going to be the experts talking about the topic of health data. My first presenter is Jacob Boone, and he is a consultant at Landscape. It's a data science bureau. And he works with organizations to really help them understand the possibilities of AI. Hi, Jacob. It's good to see you on the screen there. He's going to talk to you all about the power of big data. And together with his colleagues at Landscape, they're really looking to find tailor-made solutions for their clients. I think that's one of the things that I definitely see from the presentations today. It's all about finding what to do with the data in the right way. So on that note, I know we're joined also by a couple of your colleagues in the audience. Erwin, your CEO, and Frederica are out there for chats later in the breakout sessions. But I'm going to hand over to you, Jacob. You've got 15 minutes to give us a good introduction to how you can help us with data and AI. Thanks.
Thanks so much. Yeah, I hope everyone can hear me. If you can't, please put it in the chat so we can figure something out. And also you should be able to see me and now see my screen. And I hope you also, if you have any questions in general, put them in the QA. I think there's a separate tab for that, and we can get to the questions at the end. Should be done before 15 minutes are up. So, okay. Hi again. This is I'm Jacob, and this is Landscape. I'm a solution consultant, and we together are a young data science bureau from Leiden. At Landscape, we want to ensure that we as a society create the right kind of future with the way that we apply data and AI. And we do that by helping organizations adopt and implement human-focused and data-driven solutions. And like I said, we are data scientists. That means that our technical team has been trained in the use of machine learning, artificial intelligence, and related technologies. We develop, build, and maintain data-driven solutions for our clients. And through our own internal research and development, we have built up expert knowledge on reliability and explainability of AI models. But we're also consultants. We have a lot of hands-on experience seeing different organizations from the inside, and that has shown us what works and what doesn't work. So we know what you can actually solve with AI and machine learning and what you cannot. And we know how to integrate all these AI solutions into the business. Implementation and acceptance aren't always a given, so the soft side, let's say, is equally as important as the technical side. And we've definitely found that we need to excel at both these fields to create value for our clients. And all our efforts we undertake for our clients are guided by our focus. First and foremost, we are honest about what data and AI can achieve. We don't sell hype, we just give you the truth. Secondly, we aim to keep what we do transparent and understandable. We, and by that I mean people in general, should be able to know why systems work the way they do, especially if those systems make decisions about us. And thirdly, our aim is to solve the right problems. We need to understand the heart of the issue if we are to actually have a positive impact. No disruption for disruption's sake, but we aim to create lasting value and genuinely make work and life better and less routine. Now, here's an overview of some of the clients we've worked for in the past. There are many different types of companies and organization because, as it turns out, data is everywhere and AI is useful for pretty much every flavor of organization. So I'd like to talk a bit about what we do. In essence, we make work better in a safe and transparent way by using data and AI. Now, you may ask, what is AI? What is artificial intelligence? And I will tell you, AI is a superpower. It can learn from data to do tasks that previously only humans could do. And as with all superpowers, with great power comes great responsibility. AI is a tool, a complex tool that we can use to do great things, but we can inadvertently cause harm if we don't understand the risks. In fact, because AI can take over human tasks, it also limits the amount of control we have over the outcomes. And we need to manage what control we can exert very smartly and very deliberately. Because AI is so complex in how it works and how it can be used, there are some key things to consider when we build and implement an AI solution. For instance, what are the current key difficulties that the client is facing? This requires us to understand the client's position and condition. What positive impact can AI and data have? We know this, of course, from our training, our experience, and our research. And what is the right way to use AI here? How do we handle our superpowers and do no harm? For that, we always need to consider data safety. Privacy is often here the main concern, but there are also other things to consider. Secondly, what we call human control. How much control should the AI have and how much should the human have? Some decisions maybe we shouldn't take with the computer alone. And we need to think about what we call AI robustness. What's the potential for errors? How do we detect when they occur? And how do we deal with them? It is our mission to understand our customers well enough to help them navigate all these different possibilities and to come to the right way for them to tap into their data and AI potential. Now, I'd like to illustrate what I've just explained with some examples that basically also show why these things are important. And the first of those is Dutch hospital data. They're a foundation that are the data partner to all Dutch hospitals. And with them, we are working on a way to make the administrative tasks of assigning ICD-10 codes to patient records easier and faster. Now, this is something that's required by law. And for this example, you don't need to understand how it works. You just need to know that it's pretty tedious and pretty expensive. It takes highly skilled people to do it. And there's a big fine for the hospital if they don't. So DHD came to us and to see if we can have a positive impact. And we are now working on a way to use all the previously labeled files to teach an AI how to do this automatically. So we've built an AI that can predict the correct ICD-10 code from looking at a patient's file because it has been shown thousands of other older examples. And this actually works. That's the great power of AI. But this is medical data. So we have for sure a very big responsibility here. First off, the privacy of the patients must not be infringed. Full GDPR compliance is, of course, a given. So we anonymize all the data. But we do that in such a way that the useful patterns that the AI must learn still remain. So, for instance, there are no dates of birth in the data set. We anonymize them out, basically. But what remains is sort of an indicator of age. So the pattern still remains that older people with a higher indicator of age are still more likely to get cataract surgery than young people. And the AI will pick up on that information and be able to learn from it, even though the data is anonymized. Secondly, there's the fact that this historical data is in all these different hospitals currently. But to properly teach the AI, we needed to learn from the data on more than just one hospital. But we cannot extract all the required training data and put it in a single place. Not only would the hospitals not let us, I'm also pretty sure it's actually against the law. And from a security standpoint, it's an absolutely terrible idea to have all that sensitive information in one place when it doesn't have to be. Now, in order to tackle this issue, we actually use a technique which is called federated learning, technical term. But in this particular case, some people call it the health train, because what actually happens is that the AI, while learning, travels, as it were, from hospital to hospital to be taught on these previous health records. And it never takes any AI data with it, but it does manage to become better and better at performing this task of predicting the ICD-10 codes as it goes from hospital to hospital. Thirdly, this is actually a pretty difficult task for humans and also for the AI, and we don't want it to make any mistakes. Now, this particular AI has a notion of how certain it is when it makes a prediction. And if the certainty is too low, it actually asks the human for help rather than assigning the ICD-10 code automatically. Of course, we selected this AI specifically because it has this notion of certainty so that we can have a way to distinguish between what we could call low risk and high risk automatic actions. And lastly, we built this AI to be fully transparent. It reveals why it chose a certain code. It can show which parts of the patient data it based its decisions on. This way, we can always check whether decisions were made for the right reason and intervene when they weren't. So how well does this work? Well, the system we're currently building, with that, it's already possible to save a lot of effort. The AI is able to automatically handle hundreds of thousands of patient files and correctly assign the correct code. And when the AI, like I said, isn't certain enough, it actually presents a top 10 of predictions to the user, which contains the correct code in over 80% of cases. So that's actually much faster than the normal human user having to choose from over 2,000 codes. It only has to choose from 10 most of the time. And also, as far as we're aware, this is the first working setup of this health train principle, which not only sounds pretty cool, but also works really well in Dutch hospitals. So we're pretty pleased to be able to prove that this powerful idea, where you don't combine the data, but still are able to train an AI on it, that it does really work in real life. Now, in the second example, we worked with Pallas. Pallas Health Research and Consultancy, I should say. They're a Rotterdam-based research bureau, so extra relevant for today. And together with them, we developed an app that assists in literature review. Now, literature review is done before starting on a new research project, basically to decide which previously published peer-reviewed articles on the subject matter are relevant to your new research. And this often comes down to having to read the titles and abstracts of thousands, sometimes tens of thousands of research papers by hand. And only 5% of those might actually be relevant. And of course, each literature review is different. So unfortunately, there's no way to train an AI once on what you might consider a relevant paper and then have it pick those out immediately for each new research project, because what is a relevant paper will vary wildly from literature review to literature review. But it is, in fact, possible to have the AI read and classify papers. It can do it in other situations, so maybe we can get it to work here. So what we needed to build was a way to use this AI power, but still deal with how different each literature review is. Now, the right way to use AI here is to make sure that its decisions are directly supervised by a human researcher. The need for constant supervision might sound like a bad thing, but it isn't. It's just a given in this situation. So what we do is that we have the AI make suggestions on what is relevant, and the human checks whether this is correct. And then the AI immediately learns from this feedback, from having its work checked. And for every next suggestion, it will be smarter. And if you keep doing this, keep checking these suggestions from the AI, it turns out that this teaches the AI the pattern of what's relevant really quickly. How quickly? How well does this work? Well, we are able to reduce the required amount of articles that the researcher needs to check by 66%. So you can now do this literature review in a third of the time, potentially. And the AI ends up being very good at its job. It has a 99.7% accuracy rate, meaning very few relevant articles get left out, if any. Also, this is an easy-to-use app. It's just software. It works in any browser and doesn't require any knowledge of AI, so it has the potential to reach any researcher in the world that has a computer. Now, I want to leave you with this. I fully believe that there is a correct, right way to use the superpower tools of data and AI. And it is our mission to make those superpowers available to other organizations. Now, if you're interested in what the right way is for you or what it could be in a given situation, and you want to tap into that potential, be sure to talk to us later. Thanks very much. Sorry for being so short. Well, under 15 minutes.
So I'm back, Jacob, I think. Can you hear me? Hi. Yes. Hi, Jacob. Yeah, that was great. I think much better to have a good, concise presentation than when I have to cut you off mid-flow. So exactly. Thanks for keeping to the timing. I've just sent a message out to see if we've got any questions from our audience. Really, really interesting to hear some of the things you've been doing and very specific ways of using data in healthcare. And I guess I have a question as someone who is, a patient in healthcare for lots of different reasons. And I think we all hear so much these days about what is safe and how do we know our data is protected and what data should we make available. And I think we see more and more how important it is for, organizations like yourself to be able to use our data so you can help in the future in terms of preventing health issues. Or anticipating health issues. So what would you say is a good way to help, people out there feel comfortable about sharing their data in the future and being confident that the data is going to be protected? Have you got any advice around that or suggestions?
Yes, it is. I also have some electronic patient data, just, not as a consultant, but as a person. It floats around, right? And some doctors might have access to it and you're not really sure how it works. I think transparency of the system should be built in. And that doesn't mean that everyone should be able to view like always their own patient data from anywhere in the world, but the transparency from the people who build the systems, use the systems, that they explain to us whose data is being used, how they go about using them. And they're able to show that they take these precautions. And I think attracting AI leaders into organizations, into the field of how we in medical problems deal with this, that's definitely a way to show we take this seriously. We have the partners. It's not that, medical field can be seen as a conservative field, but showing what you're doing to ensure this, I think, that's called build forming. So transparency to the public will be the key thing here, because there's so many possibilities. You've seen there are hospitals that are, I think hospital in Amsterdam, they're going to use AI to help with IC diagnosis, intensive care management. That's a huge thing. So they have to be very transparent about how this is going to work, because this AI people might believe that it's going to make decisions about them. And if that's not the case, which it might very well be, then people need to know the AI is just an assistant, or it just helps in this limited sphere of influence. That's what people, I think, need to know.
Yeah, I read something really interesting just last week, and it was talking about data in AI in healthcare. And what it said is people don't realize that they're actually probably sharing even more about themselves these days on things like social media and Facebook, and they do that without a blink. They put everything out there, all their personal details, their family details, and what is it used for? It's actually used for commercial purposes, and at least with health data, it's actually going to be used to help you in the future and hopefully find good solutions. So
and it's actually regulated, unlike some of these big, let's say, American companies.
Right. Yeah.
Always the question.
Media. Yeah. There's a question came in from Rainer in the audience. He's saying, "What do you think about the current data integrity in medical care?"
Well, what we've seen from our partners in healthcare is that they are very. They take good care of. They want to take good care of the data. They are aware of maybe too many risks, I would say. As a data solution, as a data science company, we would say, well, we can mitigate those risks, But I would say that currently the integrity is at I would think the right level, in the sense that in fact it might even be holding some people back in how much risk versus solution people see.
Okay.
So I would say the challenge would more be acceptance of expertise in how to mitigate the risks that people see, how to remain with high integrity, but keep doing these new things, but actually explore new things while keeping the currently high integrity.
Great. Well, I'm going to stop you there, Jacob, and thank you very much for your presentation. We're going to move on to the next presentation, but just to let the audience know, you're going to be staying at the end for any questions as well, and people can come and talk to you in the Venture Cafe area. So if you have any questions for Jacob, please catch up with them later. And I see Frederic has also posted your an email address there as well, so they can also reach out and contact you. So thanks. So I'm going to introduce our next speaker, who's going to be taking the stage, and that is Damiaan Zwietering. And Damiaan is a developer advocate for IBM, and he's actually been working in data science for 25 years with IBM. And just before we started the session with the audience, I was asking Damiaan about the balloons in the background, and it was great to see the nice bright blue balloons, which is part of Damiaan's celebration. So one thing I can be very confident about today, Damiaan, is that you're definitely an expert. And one of the things that I just want to share with the audience before I introduce you finally is that you actually host and help with workshops to inspire people to use the technology, the data, and the tools that are available out there in the right way. I think that's really important. And one of the things you mentioned is it's really great to study and learn, but at some point you have to actually use that information. You have to build something. So you're ready to help our audience and get them started. So I will let you take over and share your expertise. Thanks.
Damiaan, your mic is off. Damiaan, you're still on mute. Oh no.
Hi there, can you hear me now?
Yes, it is.
Right. Yeah, I had a little bit of problems today switching audio. So yeah, there we are. Okay, loud and clear. Right. Yeah. So my job at IBM currently is developer advocate. So I'm doing workshops. So we're not going to do a workshop today because we only have 20 minutes. So that would be a little bit too much to get you hands on and up and running. So what I'll do is I'll give you an overview of the usual workshop material that I use. Just for inspiration, and I can run this workshop with you if you like, so just let me know, and I'll just give you an overview of the material that's available in this workshop that I created last year. So basically last year, in the beginning of the year, we were all asked to work from home at IBM, as everybody, I would say. My wife, who is actually a nurse, started working with COVID patients at our local hospital. So yeah, that inspired me to also start looking at data and creating new workshop material for last year, and that really got out of hand, to be honest. So I did a lot of analysis. And it's all freely available on my Git pages, and I'll just share a little bit of that today with you to get you inspired to see how you can start analyzing data yourself. And specifically today, it will be about COVID data. So I'll just share my screen with you. There you go. That should work. So what you're looking at right now is my Git page. So this stuff is all freely available. So I guess the link has been shared with you, but I'll do it anyway, so you have it at hand. So you can find all the material that I'm showing here today over there. It's all open source. It's all based on open data, and it basically all runs in your default Jupyter Notebook Python environment. So you could use this as a way to get up and running in that area. And you could also use that, of course, to start analyzing your own kind of data or build upon my work as an analysis of COVID data. So yeah, a lot of today is about starting. So as Sharon also introduced, What I encounter a lot is people that did all the courses and did the Coursera stuff and learned all the basics about machine learning and artificial intelligence. And sometimes I get a question of these people, and now what? And I say, now what? Just download some data and start analyzing. And that seems to be a little bit of a hurdle for some people. I used to be in services at IBM, so I did those projects myself. So I went into the customer's location and I did the analysis for them. But these last couple of years, I'm more get them up to speed to start analyzing their data for themselves. So that's what it's about today. So everything's available there. There's a lot of documentation. There's a README file there, so you can run through this yourself and get up and running if you know a little bit about Python and the Jupyter Notebook environment. It also tells you how to run this stuff in IBM Cloud. If you don't have an analysis environment yourself, you can have an environment there for free if you want to. So it tells you what to do. And what I'll do in the coming 15 minutes is just give you an overview of what you can find over there. So ask any questions. I'll be available at one of the tables afterwards as well for discussion. So I'll be able to answer some questions during the session, and I can answer a lot of them afterwards probably. I started out with this data set from EUCDC. That was one of the first sites last year, I think already in March, that published daily figures for positively tested corona cases. And I wanted to get an idea of how does this stuff develop? How does a disease develop? How does it spread? What patterns can you find there? And basically, what can we learn from it? And could we even start a little bit with the insights that we get, start predicting how this will progress? So I started with this data set. Main reason, it was available already last year in March. And it published daily figures for all the countries in the world that were actually submitting data to EUCDC. So that was a useful starting point. You can already see the downside, which is pretty usual when you start finding interesting data and using it on a daily basis. It might just suddenly stop. So for one reason or another, on December 14th last year, EUCDC decided to stop publishing daily figures, and they switched to a weekly publication. So I had to switch to another data source as well, which is an interesting exercise that you can also do for yourself using these analysis notebooks to see how you can plug in other source data if you want to. But just to give you a flavor of what happens, you can simply start importing that data straight from their website, which is what I did here. And basically, the columns that I started analyzing were the date reported, the number of cases reported. I started out with number of cases as a first analysis figure, and it shows you the country for which the data is reported. It also gives you the population data, which can be useful to do relative figures. So there's all kinds of interesting starting points here. And what you get here is what we call in data science, basically time series data. It's just for every country, for every date, the number of cases tested positively. So you run a couple of tests and you get into all interesting problems when you first start importing data. There's a country called Namibia, which has a country code NA, and by default NA is read as not available in Python. So you already start running into all kinds of stuff with data, which is a very good exercise because it's very practical. You encounter that kind of stuff all the time, so you can start analyzing the stuff. So I switched the data format to a more columnar format, where every row is a date and every column is a country. So you can start seeing already the first effects here. For example, the Arab Emirates, which is AE. You get to know these codes if you work for them with them for a couple of months. You see that AE already started reporting cases on the last day of last year, and they reported 0 cases. But other countries like Andorra or Austria here, or Argentina here, actually didn't report anything at that time. So you can already start seeing when people start reporting stuff. So it's already a start. And then the first graphs. So it's quite easily when you've imported this stuff to start drawing graphs. So for example, here you see the cases for Belgium, and you already see some effects going on. For example, here you see a very clear weekly reporting effect already. So that means if you just basically do a time series on this one, it will tell you that usually on Tuesdays and Wednesdays, the number of reported cases is higher than on other days of the week. And yeah, that also is a constraint for predictions, obviously, because if you do just a simple model on this one, it will only tell you, for example, if you're analyzing in this area here, it will simply tell you that the number of cases will probably be higher on the next Tuesday or Wednesday. And basically it will be rising. So it doesn't tell you very much. So to really understand what's going on, I dived into the epidemiological models that are available for this kind of data to try to get an understanding of how these shapes can be described. So actually, what kind of effect do we see in this kind of data? So yeah, that's a lot of mathematics, a lot of modeling. So I won't go into all that. You can have a look at the notebooks yourself if you're interested in that kind of data. You can see quite some problems with data. So for example, this is Ecuador. They had some weird reporting peaks. They also reported negative cases at a certain point, where they suddenly decided, yeah, well, these cases that we reported these last couple of weeks aren't COVID cases anyway. Or we are changing the way that we define a COVID case. So we subtract this because we shouldn't have reported this data. So you get all kinds of weird stuff in your data, which is a very practical effect. You encounter that all the time when you start working with real world data. So there's a lot of examples in here of smoothing that out, of finding ways to deal with these local effects, these reporting effects, and you can have a look through that to see what's going on. So I did the logarithmic plots, the cumulative plots. So there's a lot of material here. Then obviously I had to change to another data source after December 14. So I already had found Our World in Data, which is a very interesting site because they accumulate a lot of data and they consolidate it in one data set. So you can also simply download the data over there. So there's an example of the same kind of analysis there on this data as well. They use 3-letter codes for countries, so I had to learn all those codes again. But well, most of them are pretty logical. So you can use this one to start analyzing current data as well. So for the Netherlands here, it's actually updated this morning. So you have the data until yesterday. You can see the reported cases graph here, and a lot of example analyses on this kind of data. There's also local data available. So for example, this is a graph, and don't try to read all the details in there. This is a graph based on the local data that is daily published by RIVM in the Netherlands, the local health authorities. And this is just an example of a more complex visualization that you could run. So have a look at the code. It's actually one of the examples in the basic matplotlib, which is the visualization library used a lot in Python. It's adapted to this kind of data. And what you see here is the progress of the disease. The top half are male and the bottom half are female. From left to right, you're going over time. So every column is a week. And the horizontal lines are age groups. So for example, the kind of effects that you can start seeing here is that when you look closely around here, which is just after summer, is that the infections started in the younger age group first. You see the darker line here. If you can see that, I guess you can. At least don't try to read all the numbers. And you can see that it started already in the younger age groups and then started spreading out. So here this darker blob here is more or less the second wave going, and it started in the younger age groups and then spread out over the higher age groups. Then it got down a little bit. So again, the younger age groups carried it over to the next peak. And actually, you can, if you look at this kind of data closely, you can see that there's some bands going through the data, which age groups that are always the highest number of infected. And both for males and females, that is the age group between 50 and 59. So I had a close look at myself and my behavior if I was one of these people still spreading the disease, because it seems to be very strongly in certain age groups that there's always the highest number of cases. And then every now and then it spreads to other age groups. So already not really machine learning yet or artificial intelligence, but using quite some advanced data visualization to already get a feeling of the data. So have a look and play around with this kind of displays to see if you can get any data, any information to the surface that might be interesting for your organization. Then I did a lot of curve fitting, trying to find out how these curves are actually shaped. And there's a lot of material available here that shows you how to, in this case, fit a certain type of probability distribution to the data to try to fit the shape. What I did is a lot of material, and here you can, for example, see the fit for the first wave for the Netherlands. So here the blue data is the raw data with all the weekly effects. The orange one, the orange line running here, is the smooth data. And the green one is the curve that I fit to this first large major outbreak in the Netherlands. So I did that for a lot of countries to try and find out how these outbreaks actually progress. So there's quite some of that material available as well. I had a look at measures, and then I tried to build a model to find out if a country is harder or less hard hit by corona outbreaks. Does that relate in any way to the measures that they took inside the country? So here you have a list of countries ordered by the severity of the outbreak. So on top here is Qatar, for example, which had a very relatively heavy outbreak. So here you can see at how you determine that kind of number. And there's actually on a lot lower here I train a model on that actually relates measures which are taken from a data set that you can also find an open data set showing country measures. And you can, for example, see that public health measures, don't know if you can read that, but the largest bar on top here is public health measures, which has the largest impact on the corona outbreak. And for example, something like a lockdown has a lot less impact. But what it actually means is that a lockdown on top of all these other measures doesn't add that much as you would expect to measures that you're already taken. This is only for the first wave, so it's a limited kind of analysis, but it's a starting point of starting to actually analyze the impact of measures. And there's a lot there. You can actually see there. I added an explainer as well, which explains the model. So you can see for the Netherlands, for example, here that doing the public health measures relatively late had quite a negative impact on our corona figures. And the fact that we did our governance and socioeconomic measures pretty early had a very positive impact on our corona figures. So that is something that you can start doing for yourself. Basically this was only fitting the first wave. So then I actually invented a way of clustering the whole graph of a country or a region and finding out if I can fit a series of waves to that. So actually, when people are talking about the third wave, which is actually this one here, which people are calling the third wave for the Netherlands, that is for me already the 19th wave. So if you start clustering this data into more detail, you find out that there's a lot of underlying outbreaks that together shape build the shape of the overall outbreak figures. So there's quite some analysis material there as well, and some visualization examples of how you could visualize this. And then the final thing for today, but that's just to see where all this can end, is that I using all this analysis for all countries in the world. One of the examples that I created is an animated map that shows you the outbreaks all over the world. And you can see it starting in China here, and I'll stop it for a little bit here. The big blob that you see here are the accumulated figures for the world and for the continents in the world. So the fact that you see a lot of corona outbreak here, this is just aggregated figures in this area. So if you are looking at that, I'll have to find a way still to distribute that in a nice way. But actually, if you start this running, you can see the outbreaks here in Europe. America goes. You can see Russia breaking out. You can see it spreading to the Middle East. Here, India, South America starts. And then it actually, if you look at it closely, it goes back from the Middle East into the second larger wave in Europe. All the Americas are breaking out. You see a lot of outbreaks in Europe. This really becomes a big one. Then you see it going down a little bit after Christmas, beginning of the new year. And then basically at the end, it projects 1 week ahead based on the analysis. You can actually see that even in a week time, we are still in big trouble. And this is just an example of how you could take all this data together and then map it, which you can do using a couple of open source libraries available in Python. So yeah, there was a lot of material. Just an overview. If you want more detail, feel free to ask and discuss them with me.
Wow, Damiaan, very interesting and a lot of information, a lot of data. I didn't want to switch my camera on. I was so fascinated by the final map and watching it evolve. And I'm kind of really looking forward to when we can see all those orange marks shrinking and it becoming smaller, hopefully later this year. I'm going to ask the audience if you've got any questions, pop them in the question and answer session now, because we have definitely 15 minutes still left as we come to the end of the actual Life Sciences Cafe this week. But I have a couple of questions for you before the audience. So I'm really lucky when I'm the moderator. It's great. I can get in first. And I'm curious, what have you been doing with this data? Obviously, it's a lot of information and it's amazing that, it's all there. What have you been using it for?
Yeah, what I've been using it for is the main purpose of this was just trying to leverage my experience to other people that can start doing this for themselves.
Right.
So if I'm the only one doing this, I can. This is what I did in about 6 months. So how much can you do on your own? So I'm trying to inspire people to really start building on this. So there's already some work, follow-up work, for example, an alert radar that shows you how much should you worry in a country or in a region.
Right.
So is it rising or going down and stuff like that. So I'm really looking for people that can build on top of this. And what I did myself, obviously, I had a lot of discussions with virologists, epidemiologists in the Netherlands, with all the usual suspects like RIVM, the Red Cross, also a lot of the local health authorities, the GGDs in the Netherlands.
Right.
Not sure how you would translate that, but I had a lot of discussions with them. They used a bit of this material, and they gave me input back in how useful these graphs were. So yeah, I'm really starting to. I'm really trying to inspire people, to stimulate people to start building on this for themselves.
Okay.
And a couple of the insights were used directly by some of the health authorities in the Netherlands and outside as well.
Yeah, I can imagine, because this is the kind of data that's going to be used for, I guess, how the governments make decisions on how long they keep lockdowns in place and curfews and those kinds of things, and when they can start opening things up. And I also know, with working with Erasmus, is that we do have now in Rotterdam, we have the Pandemic Research Center, which is also looking at the future of the impact of pandemics, because everything we hear is this is the first one, but it's definitely not the last. And I think this kind of research and looking at what's happened, our first really significant experience, is going to be so important to help us be prepared and ready for the next one when it hits. Right.
I would imagine. Yeah, sure. Yeah.
So I see we have a question coming in, and it's from Sasha Hyman. She's actually my colleague from Innovation Quarter. And she said, thanks for the presentation. And she says, it's not always easy to bridge the communication gap between the data science and the non-data experts. Any thoughts or tips on that? I think it's a really good point, because it is often you're the expert and you're the scientist around that data, but how do you make sure that the people who don't have those skills can really translate the information and use it?
Yeah, I would say my experience is, and I started in the wrong way as well. I think 25 years ago, and sometimes it almost happens again, that I take the data and then do all these kind of analysis and then go to the non-data expert with the end result, and that doesn't really work. I mean, you really have to take the non-expert through the analysis that you did, and not in a technical way, but just to explain what kind of steps you took, what are the assumptions that are in this kind of data, because there's always assumptions. There's always a process that the data goes through from raw data until it's on my screen. So, for example, I assume that there's some kind of weekly pattern, and you have to discuss that. I mean, just discuss the steps that you took with the non-expert to get them understanding how you got to this kind of visualization, and also get them up to speed on what exactly they can, how, yeah, I would almost say, if it's feasible for them to base their decisions on this, because sometimes you show them something not to base a decision on, but just to discuss, this is what I found and what can we do with it. So
right.
yeah, you really you need a lot of interaction. So never make the mistake of just taking it, locking yourself up in a room for 3 months and then just coming out with the results. That will never work.
Yeah, it's really a learning process to go through together, I guess.
Yeah, sure. Yeah.
And I know from the community and the life sciences, it's great to have someone like you come on board and share your expertise and know that you're available. I would say we have a lot of companies that are starting up innovations in healthcare, and it's really important for them to have access to data and information that relates to their innovation or their products. Sure. How easy is it for them to access the kind of data you've shown, which relates to COVID, but other types of health data? What are the avenues they can go through to find out these kinds of information?
Yeah, that might be a struggle. So basically, this kind of data is openly available, but what actually is available is pretty limited. So I based most of these analyses just on the time series of infected cases. So that's a very simple data set, basically. Which is available, but also showing you that you can, with even those limited data sets, you can already do quite a lot. And then obviously, if you want to explain what's happening here, I mean, I just show that stuff is growing and the way that it's spreading over Europe and then shrinking again and stuff like that. But if you want to explain that, obviously you need background data about, hey, I see cases are growing in the United Kingdom, for example, but why are they growing and under what circumstances? So that's really starting to look for data. But then there is a lot of open data available. So even all these government measures are available in an open data set. So for example, Oxford University publishes a stringency data set, where they do a daily stringency figure on countries. So they say how stringent are the measures today, and even spread out over a couple of categories. So are we in a strict lockdown or not? Are any travel measures taken? Are we doing any quarantine measures? So you can there is a lot of open data, and what usually works best for companies wanting to start with this is start getting experience with these open data. And then project that on your own data to get the information for your own organization. But even within an organization, it can be quite a problem to get into data. To be honest, there's a lot of people guarding their data very closely. There might be privacy issues, so it's always. I think we just had a good story from Jacob Boon about that. There's still always quite some issues about actually accessing and using data.
Yeah. So I think access to data is definitely something that we need to look at, and maybe could be a future topic for one of our cafes to get some experts that can actually help with that access or creating the data and ways to make sure that we're recording it. So if anyone in the audience has any knowledge of that or any tips, I think we definitely all welcome them as well. And maybe just one last question. I see we've got about 5 minutes left of the cafe today. Because of your insight and your knowledge, do you have any predictions for the future? Can you give us any rays of hope that we're coming out of this pandemic and we're going to be able to all meet up in the Venture Cafe in person at some point soon?
Yeah, well, what I can see, for example, if you look at Israel, where they are pretty far with vaccination, the vaccination really shows in the figures for now. Since a couple of weeks, I can see a lot of countries that are really let's say the original curve that they were in, they're breaking the trend. So that must be because of vaccinations. That's something that you can easily relate to that. So I think that will already help a lot. The other side is that what you are looking here is human behavior. And one of the things that I found out and keep running into is it's very hard to predict actual human behavior. So what was already predicted and what you can see, for example, with vaccination, is when you start doing that, the figures will first rise. And that's because
Right.
of two reasons. People think that, oh, now I've got my vaccine, so I don't have to behave anymore. That's simply, I mean, that happens. We're all human. So that's what you see. And the other thing is that people in a lot of countries, people actually have to travel to their vaccination location. So you get more infections then. So it first starts to rise a little bit and then goes down. But how exactly that will work also differs a lot between countries. I mean, then simple cultural aspects come into play, like how well behaved are people in a social situation regarding infections. That differs a lot. You see a lot of difference between countries. So, and then we don't have enough countries in the world. It's only about 200 countries to really make a reliable model for that. So that's a bit of a problem. If we had hundreds and thousands of countries, we could do a good model. But yeah, I mean, we know that the Netherlands are a lot different than Japan. But it's too little information to really use that for a prediction.
Right.
So
well, I think you've got a lot of data that you're going to continue collecting over the next few months, and maybe it'll be nice to get you back in later on in the year and see how we're doing, and hopefully see some really positive results, so we can start some nice social gatherings again. And human behavior is definitely something that's difficult to control, so that doesn't make it easy.
Yeah.
Thanks, Damiaan, for joining us today. I'm going to make sure that, we have the cafe afterwards. So I'll remind everybody who's watching that they can come and talk to you in person and reach out to you if they've got any questions. So thanks for you and for Jacob. And maybe just to wrap up, I just wanted to mention to everyone in the audience that the Venture Cafe, the next one will actually be on the 1st of April. Thursday, the 1st of April. And if you have a topic that you would like to present, or you have a topic that you would like us to cover, then please let us know, because we're really keen to keep this coming on a monthly basis to interact with the Venture Cafe audience, but also the startups out there, the life sciences and health communities, to make sure that we handle some of the issues that are happening right now in life sciences, and also to connect you all. So thanks for joining today. Thanks for the great, really interesting and educational presentations. I've learned a lot, and look forward to seeing everybody in the cafe after the session. Thanks. Thanks, Damiaan. Bye.